Hello and welcome to Highlights. My name is Jim Schron, host of the program. Highlights from the heart of our community is brought to you through a collaboration between Jim Schron and Company, HD Media, and the Media Center, and our title sponsor, Banker's Life. There's no life like the Banker's Life. We certainly hope that you're a regular viewer of the show, and if you are, you know we love to focus on those grassroots organizations, great people running small businesses, corporations, anybody and any organization or company that's moving our great state of West Virginia and our Canal Valley and our city of Charleston forward in a positive way so that we can make it a better place to live, learn, work, and to play. And on today's Highlights program, we're going to feature an organization that is doing all of that and much, much more. It's a fairly new provider of mental health services, behavioral health services, checking in with our emotional and mental well-being. We're going to be talking with 4 folks who happen to be part of the clinical team with Harmony-Charleston, a member of Transformations Care Network, as I mentioned, a brand new mental health provider. They're located at 1 Kenton Drive, Suite 200, out at the Northgate Business Park on your way toward the Yeager Airport. So lots of good insight coming your way, lots of really good information coming your way. And many West Virginians, about 1 in 3 West Virginians need mental health services at one time in their life. So we're going to be talking a lot about education with people who understand mental health from a clinical standpoint. So sit back, soak it all in, take it all in. We'll give you some numbers. We'll give you some information to go to look for yourself. But this pretty serious topic we're going to be talking about today, and mental health is always needed in our society. To help us talk about mental health and Harmony-Charleston, I have with me a good friend of mine, Dana Petroff, Dana L. Petroff. Dana, how are you?
I'm great, Jim. Thank you so much for having us.
It's great to have you on the Highlight Show. You're the clinical director with Harmony-Charleston, a member of the Transformations Care Network, correct?
I am.
And you brought along some of your clinicians.
I sure
Jeremy's
did.
with you. Jeremy Walker, how are you?
I'm good. How are you?
Now, you're a family nurse practitioner, right?
Yes, sir.
Well, I'm going to come back and talk with you in just a moment. And we have some other folks that we're going to talk with after this segment. So you brought a whole bunch of clinicians with us here today, Dana. But let's talk, first of all, about Harmony-Charleston.
Okay.
It's fairly new. Talk about who you are, what you're made up of, and why you guys are existing.
Alrighty, so Harmony-Charleston is a member of the Transformations Care Network, which is a large company, and we have several offices in West Virginia, but we are the first one in southern West Virginia, so we're really excited about that. And we have a beautiful new office at Northgate Business Park, as you mentioned. I am blessed to work with a team of incredible medical professionals as well as fully licensed therapists. We have Dr. Victor Neese, who leads a team of 5 nurse practitioners and a physician's assistant, and we are just ready to go, and our doors are open. We're ready to see people both in person or if they need to be seen in telehealth, because we will provide services to the surrounding areas, not just Charleston, but the surrounding counties.
Well, that's really good to know. So you don't have to come to 1 Kenton Drive, Suite 200, where your office is located at Northgate Business Park. You could do the telehealth thing, which is pretty popular right now, isn't it?
Absolutely, and so it gives us the ability to reach more people. So some of the folks in Boone County, for example, that might not be able to get clear to Charleston, we can still work with them. Clay County, and just all of our surrounding counties around Kanawha County.
So you do work with Canal Valley, Kanawha County, and the contiguous counties,
Absolutely.
And even beyond that, if they wanted to call in or even come to visit you, they can come.
Absolutely. We really want to focus on in-person sessions.
Okay.
After COVID and everybody kind of being isolated, we really want to have that human-to-human interaction. And
I mentioned at the top of the show, I said, maybe 1 in 3 West Virginians, and I've kind of used that number generically. I used to work in the mental health arena for 30-some years, so I remember that number. I think nationally it's about 1 in 4, but seemingly in West Virginia, I don't know why that is, but about 1 in 3 West Virginians have issues when it comes to depression or anxiety or stress or addiction, or just there's a plethora of diagnoses. You guys are treating all of these issues and all of these diagnoses and making sure that folks get on the road to mental health, right? Mental wellness.
Absolutely. Our mission is to provide exceptional mental health care to our community.
Okay.
And although we're a larger company, we have providers from our community. So this is our people helping our community. And yes, we see a wide range of issues. We have fully licensed therapists that are qualified to see a number of issues, like you mentioned, and then our medical staff that can provide the psychiatry, psychiatric diagnosis. We have a psychologist that can do some testing.
So within your medical team, you have a psychiatrist, psychologist, these family nurse practitioners, clinical therapists,
A physician's
a
assistant.
physician's assistant, the
Yes.
PAs. You have basically everything that you would need if someone would come. And you treat all ages, I'm assuming? You treat children, teenagers, and adults?
Yes, and in particular, that's a strong need in this
Okay,
area.
yeah.
And Dr. Victor Neese, who I mentioned,
right.
is a child psychiatrist
Yeah.
and one of the only in the state.
And so well known and so good. I remember him from years ago working with
Absolutely.
him. He's still around doing a great job, isn't
Yeah.
he? And so we are talking with Dana Petroff. Dana is the clinical director of Harmony-Charleston, a member of the Transformations Care Network, 1 Kenton Drive, Suite 200, Northgate Business Park. If you'd like to get a hold of Harmony-Charleston, give them a call directly at 304-460-5123 and extension 3400. That number is on the screen. If you'd like to follow them on social media, go to Harmony-Charleston. They're known as Harmony-Charleston. There's a few Harmonies and there's a few transformation networks, so Harmony-Charleston should get you to where you need to be when it comes to Harmony-Charleston on Facebook. Jeremy, we've known each other in a former life, haven't we?
We sure have.
It's good to see you again.
It's good seeing you.
Talk about your journey to become a family nurse practitioner. I want the audience to know who you are. Are you from West Virginia?
Yes.
You grew up in West Virginia. Talk about your journey.
Okay, I was originally raised in Roane County.
Okay.
Later moved to Clay County.
Home of the Raiders, right?
Yeah.
Okay.
Yeah. So my dad had a lot of medical issues, and it kind of pushed me into the medical field because, you know, you always want to make a difference.
Right.
My first job as an LPN was actually in Highland Hospital.
Right.
So really liked the mental health part of it. Later, I went on to be a nurse practitioner in 2016. And then I done primary care, and now I'm in psychiatry.
Yeah.
So I just feel like I've kind of had that in my life, like a calling to help people. So that's...
Well, I say this a lot, Jeremy. You know, when you align your soul with your purpose, it really is not like work, and it feels like you've aligned your soul with who you are and what you want to do. You're old enough to know what you like. What are some of your patients that you like to work with? What's your kind of forte, your specialty, if you would?
Well, I really liked working with people with anxiety, depression, ADHD. I even really like mood disorders.
Really? Yeah.
So
It takes all kinds, Jeremy. It takes all kinds. What are you seeing? What's society throwing at people that's causing them, you know, all this angst and issues that they need to give you a call? And then how do you help them? That's a two-part question. What are you seeing out there?
a lot of people struggle with things from their past. You know, and they don't know how to deal or process things. And sometimes they need a little bit of a medication, you know, so we prescribe, you know.
I was going to segue into, typically most people think an MD or a DO or a physician, they have the prescribing privileges, but as a family nurse practitioner, we're going to talk to two other members here after a while. They also have prescribing. So there's medication management right directly with you. You can provide the counseling and the therapy that they need and get them the homework that they need, but you can also prescribe some proven medication, can't you?
Yes.
That's a pretty good deal, right?
Oh yeah, it's wonderful helping people.
It's kind of you come and you're not an inpatient facility, but you can really do just about everything else to help the patient get back in the game of life, right?
Right.
Talk about maybe are you seeing children? Are you seeing teenagers? Are you seeing adults? Or are you certified to see all ages?
I can actually probably see all ages, but I prefer to see 18 years and older.
Okay, so you like the adults. Very good. How's things going with your, Jeremy and the clinical team? You guys are seeing some patients, but with your team, it probably seems like there's more people out there that still need help, and you want to make sure people know that you guys are available for the help, right?
Absolutely. I mean, obviously Jeremy is awesome, as is the rest of my team. We have put together such an incredible team, and we were really blessed to be able to just kind of handpick the providers that we wanted to be a part of our team. And so we although Jeremy prefers a little bit older, we have providers that do the younger children. Dr. Neese in particular
There's
does
not
the
very
child
many. You mentioned, I
psychiatry.
want to say it again, there's not very many child psychiatrists in the
Right.
state of West Virginia, let alone
Correct.
in the Charleston Canal market. So
Right.
if you need psychiatry, if you need to see a psychiatrist in your family and you're a 5 or 6 or 7 or 8 or 9 or whatever, if you're a child, Dr. Neese is probably about the best person to go see, isn't he?
Absolutely.
Yeah.
And then that's supported by our clinical staff, our licensed therapists that are trained to work with children as well. So we have the whole gamut. We have the whole range to offer for all ages.
Let's talk about, Dana, where the rubber meets the road sort of thing when it comes to how our patients and how our families and how do you bill all insurances? Do you accept Medicaid? If you're over 65, do you accept Medicare? What are some of how can people get help to pay for some of the treatment that you provide?
So one of the great things about Harmony, and because I've been around for a long, long time, I can tell you that one of the favorite things for me to say is, yes, we accept Medicare, yes, we accept Medicaid. So there is no one funneled out through, I know there have been a lot of people trying to get services and people won't accept Medicaid or Medicare. We have the ability to do that. And so we do not have to limit anyone that we see. And if people need to pay in a different manner, we work with them to do that. So it's really a blessing and a great opportunity for us to open our doors to everyone.
Again, we're talking with Dana Petroff. Dana is the clinical director with Harmony-Charleston, a member of the Transformations Care Network, 1 Kenton Drive. It's at the Northgate Business Park. They're in Suite 200. The telephone number is 304-460-5123, extension 3400. Give them a call. Ask for Dana. Michelle or somebody will answer that phone. Tell them who you need to see. If you don't know who you need to see, Michelle and Dana can help you matched up with the right clinicians. I'm going to turn to Jeremy Walker, one of the family nurse practitioners with Harmony, and ask you if there's something that you want the audience to know about you or about Harmony that I haven't already asked you, kind of a parting shot as we kind of segue into the next segment. Jeremy, parting shot?
Yeah, I would like to say that I know people, a lot of us, we all have problems, but sometimes those problems get a little out of hand, and sometimes they need help. So we're there to help where needed. So people would be doing good if they would give us a chance to help them.
I'm going to follow up with, when you see patients, do you see them progress? Do you see them, help seems to work, right? But you have to make that phone call, and that's what I think people, sometimes they struggle with mental health. Oh, I can't see that, or I just got to do this on my own. They don't think of it like physical health, but you see real progress when you talk to your patients, don't you?
Oh, yeah. Yeah. We kind of help them find that inner strength is what our job is.
Dane, I'm going to ask you the same question. Is there something that I haven't asked you that you burning on your heart that the audience needs to know about Harmony in Charleston?
Well, I think just that we have a group of providers that are passionate about mental health, and we have been, I'll speak for myself, I have been for 30 years. But the quality of care that we provide is exceptional, and that is a part of our mission statement, that we want to provide the exceptional mental health care to this community. And it's a community that we're all from. We aren't coming in. We are from here, and we want to help. And people that reach out, the stigma is reducing, and so if you need it, reach out. We're here to help.
Very good. Dana, best of luck to you.
Thank you.
I appreciate you stopping by the Highlights
you.
program. Jeremy, best of luck to you too, buddy.
Oh, thank you.
Keep up the great work. Many of you know I'm a mental health advocate, so I think what you guys are doing is great. So we're going to take a little break here. When I'm rejoined, I'm going to have Erica and Maggie. They are a part of the clinical team with Harmony-Charleston Transformations Care Network. So we're going to take a quick break. We're going to thank our supporters and we're going to thank our sponsor. Then I'll be right back with Erica and Maggie. And we'd like to take this opportunity to thank our supporters of the television program. Highlights from the Heart of Our Community is brought to you through a collaboration between Jim Strawn and Company, the Media Center, and HD Media. And our newest sponsor, special thanks to Bankers Life. There's no life like the Bankers Life. For over 140 years, Bankers Life has provided financial security to their clients and policyholders. During that same time, Bankers Life has helped change the lives of many of their associates personally, professionally, and financially. Questions? Do you have questions regarding Medicare and Social Security? Give them a call, 304-757-4134. Or if you're interested in a free review with a licensed agent or looking for a new career in the financial industry, contact Dennis Harmison, dennis.harmison, Harmison, at bankerslife.com. There's no life like the Banker's Life. And we are back just like that. We appreciate you staying tuned in with us. This is Highlights. If you're just checking us out, Highlights from the Heart of Our Community. What a great conversation we had with Dana and Jeremy. Dana, of course, the clinical director with Harmony-Charleston. Jeremy, one of the family nurse practitioners, FNP. I'm going to give the number one more time. I've given it a few times. But if you have a mental health issue in your family and you don't know where to turn, call Harmony-Charleston, 304-460-5123, extension 3400. Dana's clinical team, the clinical team at Harmony-Charleston, they are accepting new patients right now. They're fairly new to the market, so you don't have to wait very long to be seen if you are in need. If you have a behavioral health issue, mental health issue, anything that may be causing some trouble in your family, give Harmony-Charleston a call. Now, as promised, I am joined by two more members of the clinical team with Harmony-Charleston. Erica, how are you?
Hi, Jim. Nice to meet you.
Erica Gano, a family nurse practitioner.
Yes.
And you brought another family nurse practitioner from Harmony-Charleston, Maggie Wheeler. Maggie, welcome to the program. How are you?
Thank you. Doing great.
Good. So both of you are clinicians, both of you are family nurse practitioners, both of you are part of the clinical team with Harmony-Charleston. Eric, I'm going to turn to you and ask you a little bit about where you're from and your journey to get where you are today. Are you a West Virginian? Kind of talk about what led you to Harmony-Charleston in your journey to become a family nurse practitioner.
Yes, of course. I was born and raised in West Virginia.
Nice.
And I grew up in Winfield, West Virginia.
Okay.
It was just, I lucked out and I was able to actually practice. I've been practicing as a nurse practitioner for over 10 years, and I was able to practice in my hometown of Winfield for 3 of those years with family practice.
And now you reside in the Charleston area and a clinician with a family nurse practitioner with Harmony-Charleston.
Yes.
How's that going out there? Do you like it?
Oh, it's a beautiful site.
Yeah.
It's beautiful. Brand new.
Yeah. And the site is 1 Kenton Drive,
Yes.
Northgate Business Park, Suite 200, right?
Yes.
I've been there. It is very nice.
It's beautiful.
Got a lot of trees around you. And you got this beautiful professional setting. Very nice. Maggie, I'm going to turn to you. Kind of same thing. Where are you from, and how's your journey been to become a family nurse practitioner?
Sure. I was born and raised in Charleston.
Okay.
I did my undergraduate degree at WVU and my graduate degree at Marshall University. Graduated with my FNP in 2016 and worked primary care for 6 years until I was given the opportunity to work for Harmony-Charleston.
Erica, I'm going to turn to you first. Is there a specialty that you have as far as an age group or a diagnosis that you like to treat, or you, in general, just kind of see all ages and take care of whatever the issue is?
Well, so I'm certified to treat all ages,
Okay.
lifespan. However, with my history, my experience, I am more comfortable with adults.
Okay.
So as far as diagnoses, they're all interesting. Everyone has their individual story or why they came to see me. So there's no specific diagnosis that I exclude or that I choose to treat.
I'm going to ask you the same thing I asked Jeremy in the previous segment. What are you seeing out there? What are people experiencing? It's a tough world out there. Society's difficult.
It is.
And we know about physical health and physical pain, but so many times we alleviate and don't see the mental health, the anxiety of emotional well-being. We don't see it, so it's not an issue. What are you hearing and seeing, and what are people calling you and coming to see you for?
Well, so in the world of COVID, not post-COVID, because it's definitely not gone, but the changes in financial, statuses in their homes, changes of careers, changes with schooling of the children, just a lot of strain on the family system. And then also, the holidays are coming up. That's always a positive, but yet sometimes a strain on patients. So I'm hearing a lot of that. Just, I've done as well as I can for so long, but I'm reaching out to you because I need help.
I know as we tape this show, Maggie, as I turn to you, the National Stress Awareness Day was, I think, November the 3rd, a couple of days past taping this show. So stress is a big issue, and we all know about stress, and many of us have some stress, and quite frankly, I think some stress is pretty good. We just don't want it to debilitate us.
Right.
But what are you seeing? Kind of the same question. Who do you like to see? What are you seeing? What are you hearing? Why should people give you a call, and what do you do for them, sort of thing?
I'm going to piggyback off of
Okay.
Erica's answer a little
Okay.
bit, because really I'm willing to talk with and see anybody who wants to come in and try to focus on their own mental health and feel better. Because I noticed in primary care that many people who suffered with mental illness were not able to care for themselves physically. We usually see people with mental illness also struggle with a lot of cardiovascular diseases, stroke, diabetes, heart attack. And in order to really get a good handle on those more medical diagnoses, you need to have proper mental health care.
There's a study that I have used for many, many, many years, and I mentioned in the previous segment that I worked in the mental health arena. And I do some public speaking, and there's one study that I just hang my hat on, and you kind of touched on it. If you go to your physician, your family practitioner, for a physical pain, the Center for Disease Control says that physical pain, many, many times, almost 8 out of 10 times, can be rooted back to a mental or an emotional or behavioral or attitudinal root cause. So I'm going to look at both of you ladies and say, if you take care of yourself mentally and emotionally, you're actually going to feel better physically. Is that a true statement, Eric? I'll start with you.
Yes,
Yeah.
yes, very much so. And that's, one thing coming from previous work experiences, we would refer patients to psychiatric care, and it would be months before they would get an appointment, 4 or 6 months. So Harmony of Charleston, we have our arms open wide, and we are wanting these patients to come in. We will, we'll provide the therapy and the medication management, but also we can check blood work, we can order lab work, and to see, are there those risk factors that we need to address with the primary care, or get that patient into a primary care, because a lot of our patients come and we are the only ones that they see at that moment. So then we can outreach and really take care of the patient as a whole.
Very good. We're talking with Erica Gano. Erica is a family nurse practitioner with Harmony-Charleston. We're also talking with Maggie Willer. Maggie, as well as Jeremy from the previous segment, is a family nurse practitioner. Give them a call. There's not a long wait to get in. They are, as Erica said, open arms. Give them a call, 304-460-5123, extension 3400. Find them on Facebook, Harmony-Charleston. Maggie, I'm going to turn back to you and talk about, as a family nurse practitioner, and Erica touched on it, as did Jeremy, but so many patients don't understand that they come to you and they're talking through their mental health issues, they're talking through their depression or anxiety or addiction or relationship issues or whatever it may be, but they may need some proven medicine to help them deal, cope, get back in the game of life. They don't realize, maybe they do realize, but I don't know if everybody realizes, they don't have to see a psychiatrist or a physician for that. You guys can do that, right? Talk about the benefits of that.
Sure. So family nurse practitioners are able to diagnose, treat, assess, interpret labs, come up with care plans independent from a physician. And most of our providers, most of our nurse practitioners and our PA have had years of experience already, which is excellent. But Dr. Neese is always available for us to collaborate with. We have a very strong team, a very open team, and we lean on each other and we bounce ideas off each other. So anytime there's a question or a concern, we have plenty of people to go to.
Eric, you mentioned it earlier, and I'm going to kind of piggytail with the question. I'm so concerned. I'm an older gentleman. Everybody knows I'm 62 years old. I'm not ashamed of it. But gosh, my childhood was just carefree adventure and fun-filled times. And I worry about children today, what they face, the anxiety they go through, the bullying, the stress-related things with grades and making the team and making the cheer. I mean, it just seems social media is a good thing, but it's not a good thing sometimes. Are you seeing families just struggling with the whole dynamic of being a kid? Are you seeing that? I feel it.
Yes, so like I said, I don't typically see the children, but I see the children's parents,
right.
and their parents come to me with concerns of doubt and guilt and, all of these concerns and thoughts that, and our care is patient-centered. So you would come into the office and I would ask you why you were there to see me, and then you would help guide your therapy, guide the conversation. We would never press you to talk about, topics that you would not want to speak of, but, we form a relationship. So yes, to your question, the parents that I'm seeing are having fear at this point.
Maggie, kind of the same thing. It feels like a two-way street when it comes to the patient and it comes to the provider, the individual provider being you, and folks come, you give them homework, you work with them. How long would you expect, if someone comes and sees you, do you see them again? How long would you expect to possibly see somebody?
Well, it really depends on
Yeah.
the person and the case and what brought them in. But we're happy to see patients for as long as it takes to get them to their optimal mental health.
Okay. And you guys are open Monday through Friday?
Yes.
It's not a weekend thing. It's not inpatient. So Monday through Friday, usually 8 or 9 a.m. Is that when you try to get open?
Yes.
And you'll see patients until about 4 or 5. Any evening hours, any time of the week at all, or is it pretty much done about 4 or 5 o'clock in the afternoon?
4 or 5 o'clock.
Okay,
Right. Yep.
so about an 8 to 4, 9 to 5 sort of thing, Monday through Friday. I'm going to turn to the camera one more time and give you the telephone number. It's 304-460-5123, extension 3400. Find them on Facebook, Harmony-Charleston. And Maggie, I'm going to give you a parting shot. Is there something you want the audience to know about your individual practice, Harmony-Charleston? Maybe something you want the audience to know that I haven't asked you?
I want to encourage the community to call us.
Okay.
Even if you're in doubt, even if you're not sure, if you're struggling, call us. We're here, we're available, and we look forward to meeting you.
Erica, parting shot from you, young lady?
I'm so excited to meet our community, and I know that Charleston and West Virginia as a whole is underserved with mental health, and we are here to help you.
Very good. We're going to leave it at that.
Thank you.
Great job, ladies. Best of luck to both of you.
Thank you.
And there you have it. Mental health, big issue. West Virginians, as Erica said, underserved. Not any longer. Call Harmony-Charleston, 304-460-5123, extension 3400. Find them on Facebook, Harmony-Charleston. That is all the time we have on this edition of Highlights. As always, brought to you by Jim Strawn and Company, HD Media, and the Media Center, and of course our title sponsor, Banker's Life. There's no life like the Banker's Life. That's all the time we have on this edition of Highlights. We'll see you next time right here. Until then, please take care of yourself. Thank you.